is 102.3 WHIV LPFM in New Orleans. We are Radio NOLA HIV with programming. That's right, programming dedicated to human rights and social justice. WHIVFM.org. We honor independent voices. We are not a radio station with a mission. No, we are a mission with a radio station, and that is to end all wars. Welcome to COVID Noise Filter, the daily hour-long show. I'm your host, Mark Allen Dery, sitting across the digital divide. It's my friend and yours, co-host and co-founder of NoiseFilter. Oops, I can't even get it right.
That way. Yep.
Right.
There we go. Yeah.
Dr. Eric Griggs, say hello, Doc Griggs.
Hello, Doc Griggs.
How are you doing, my brother?
Good, man. Good. Heating up outside.
It is hot, dude. And you first thing in the morning, it's already hot, huh?
Yeah, and the humidity's up, the dew point and all that stuff.
What's it up to now?
It was 77 earlier as a dew point. The heat index in Raceland, Louisiana, which isn't far from here, was 102.
Wow. What's the dew point? That's the point that water evaporates?
Yeah, it's a point that it's a point water starts to evaporate. You feel every bit of it.
Right. Yeah, it is. It is hot. No question about it.
Question: are we on air? I see two people, and I don't see the chat populating.
Yeah, we're on air. I think it's gonna take a second for us to jump on.
Cool.
But good. As always, as people starting to jump on, please, we always appreciate you hitting all the buttons that tell people that we're here. Like, share, say hello to us. Apparently, Restream, which is the what we use to stream, will send us lovely messages when we hit some threshold of those that give us the likes as well as the streams. And if we get like 20 text messages in the with you guys chatting with us, maybe we can get Doc Griggs to show his little puppy.
We got to find him. He's been outside all day. He's surprisingly, he's knocked out. He's knocked out.
He's at your feet? Is he tuckered out?
He's kenneled. He's in his kennel because we have to make sure he eats and drinks water. So we have to get him to focus.
Because otherwise, he's a little puppy and he's just running around.
Oh, he's all over. He's with the long waggy tail. Long waggy tail.
So I thought we had a great a segment on WBOK today. While I'm loading up the show, maybe kind of explain a little bit what we talked about.
Yeah, we did. We went over kind of where we are, folks, like with the fact that we're not out of the woods. A great question came up about going to church and singing choirs. We talked about this the Delta variant, the one previously known as the variant from India. It is now known as Delta. It's a little rough if we're not careful. Now's not a time to relax. That's kind of what we overemphasize, right?
Right. Yeah. I mean, I don't have much of them today, but on Friday show we'll be talking a lot about variants. I got called in to do another presentation to the Public Health Task Force Committee. So on Friday, I'll be prepping slides for the next couple days. So for Friday, we'll be talking a lot about variants. Everything you wanted to know about variants, we will be talking about. But I think that, I will kind of skip to this right now because we are talking about it. I want you to have a look at this slide, Doc. I was going to show it today while we were on air, but it didn't make sense and it was just difficult to do. But this is, for me, one of the scariest slides I've ever seen. When we're talking about things like variants. And so have a look here at this. So what we're looking at here is on this side here, this is the way the breakdown was as of what day?
January.
May something, maybe even like July. You can see that the distribution of the variants, you can see my cursor here, right?
Yep.
Yeah, you can see the distribution of variants. So this was what we refer to as the alpha variant now. This gold is what we refer to as the wild type virus. This is the virus that actually emerged out of Wuhan. You can see it's pretty much gone, right? But you can see that this is a majority, 60% is this alpha virus, right? But then here you've got this amount right here, which is these so-called California variants, and then this is the Brazil, but that's gamma, right? Yeah. This is gamma, okay? So this was about a week and a half ago. Now look at it now. Whoa. Look how
wow. Yeah.
Yeah. What do you think about that? That's
called an exponential curve.
Can you believe that rise, man? 117 exploded. Look at that, man. Look at that. Just boom. Like exploded.
Almost, it looks like almost overnight. Like
yeah. I mean, it's either that or people are starting their own variants labs. Certainly, we're in the process of doing that here right now as well. We do have some interesting updates with that. In fact, I got to text Chris about that. We are getting closer and closer to being able to have our own variants lab. So this way, we'll be able to determine what is active here in Orleans Parish. But I guess the big news, and if you were to talk about anything if you were on the news today, I imagine that one topic that would be coming up is this so-called Delta variant that we were talking about a moment ago, now being 6% of what we see here in the U.S.
Yeah, this is history repeating itself. I remember, I don't know what's significant about 6%, but if you remember in March, the beginning of March, at some point we were saying that the B117 was about at 6%, and we were worried about it being the predominant strain by the end March 31st. Well, it's not March 31st, but here we are. It's there.
Yeah, absolutely. Very, very problematic. And so we need to be very, very clear about it. And we are going to see potentially more of this so-called Delta variant. We saw a lot of this B117. But I think probably the most important news, and Eric, if you could explain who is getting COVID right now and what the risks are.
In New Orleans, the trend is that 91% of the new diagnoses of COVID-19 infection are in African Americans. And it's largely due to vaccine hesitancy and people not being vaccinated. Doc, I'm going to throw the ball back over the net to you to follow up with the stat about vaccines and infections.
Right. The issue here is that people who are not vaccinated, that the rate of COVID amongst people who are not vaccinated is the same as it was in January. So the rates that we saw in January, now of course hardly anybody was vaccinated in January, it was just healthcare professionals and maybe the elderly. But the ability to be vaccinated in January was almost non-existent. Therefore, most cases were amongst unvaccinated people. In January, we saw that big peak, right? Well, what we're seeing now is those rates that we saw in January match the rates of people who are not vaccinated now. So what does that mean? That means getting vaccinated is of critical importance. We cannot urge that enough. And furthermore, what it also tells us is that the vaccine works. 2 or 3 rather, and lastly, if we still have pockets of people who are not vaccinated, the concern is that because these are slightly more virulent organisms, that this could rip through those populations with more virulent organisms, also giving the opportunity for a greater chance for the viruses to mutate as well. So in short, we just can't urge enough the ability for people to please go get vaccinated. And so so those are the things, I think those are the big updates right now.
Yeah, that's huge. I mean, there's no, got an interesting question from Fetty. You just saw it?
Yeah, I mean, rates of cases or rates of vaccinations?
Rates of vaccinations are definitely going up because they were at 0 before.
And then children are being defined. Well, I mean, and we all saw that Ochsner, one of our local hospital systems, is starting a clinical trial for 5 to 11s. So that's really great news. That's great news. So
Process
hopefully,
is called de-escalation.
what do you mean by that?
The clinical trial process for authorizing vaccines for kids is called, the clinical trial process is called de-escalation, and they do it by age group.
Got it. Cool. All right. Well, should we get started? Infections. Have rates gone up for children for infections? I think we're seeing greater rates I think overall, yes. And I think we're seeing greater rates of hospitalizations as well. Eric, do you know, or are you familiar?
Yeah, I know back that the teen hospitalization rate up through March 31st was higher than ever. But we're 2 months out. I don't know what the latest stats are.
Right. All right. Well, let's go ahead and get started. We got lots of show to do. Lots of good and interesting information. All right. Experts say San Francisco may be the first major city in the U.S. to hit herd immunity. There's still about 137 cases a day, but they aren't gaining enough of a foothold to trigger wider outbreaks, and that's what herd immunity is. And for all practical purposes is what herd immunity looks like. Nearly 80% of people have received at least one shot, with 68% fully vaccinated. Wow, that's amazing, right?
Yeah. And finally getting a picture of what herd immunity actually looks like instead of this mysterious light switch that goes off, because that's definitely not the case.
No, absolutely. We're so happy to hear that and be able to report on that. That's what herd immunity is. You have such a large number of people who are vaccinated, and then eventually the virus can't take a foothold. It's still going to go from person to person. And one of the several things are going to happen. One, it's going to find a pocket of people and rip through it, or it's going to peter out, which is what we hope for, or it could produce a variant ultimately. And once it produces that variant, that could be the potentially vaccine evasive organism. And so here we got a question right here. Eric, what are your thoughts here? We can't click on the way that this app works, Ron. We can't click on it, but concerts too soon, mega concerts too soon. Yeah, we would think so, right?
Yeah.
Even outdoor.
Absolutely, 1,000%. With all the variants, it's not like once you get vaccinated, your eyes turn green. You know who's vaccinated and who's not. I just think it's too soon. I think we're moving way too fast. That's my thought.
Yep. So moving on here to our next story. It says, while San Francisco and some other places are doing a good job, the White House is increasingly resigning to the prospect the U.S. goal to have 70% of Americans at least partially vaccinated will be achieved. So it looks like that's not going to happen, and the pace of new vaccinations has dropped below 400,000 people per day. I did not realize it was that low. I have another statistic coming up saying that it's like 1 million people per day.
Wow.
But that is pretty low. I hope that we can increase it. Toronto-based MasterCard, one of the biggest in the world, over the next 3 years is going to spend $1.3 billion to vaccinate more than 50 million people in Africa. The country needs the help as fears grow of a third. Wait a second. Look, they said that country? Oh my goodness.
You mean the continent? I'm sure that's what they mean, is the continent. They got to mean the continent.
The continent needs the help as fears grow of a third wave. The single dose of Johnson & Johnson should be available starting in August.
Wow.
1. I know. That's a hell of a typo, huh?
Wow.
The 1.3 billion. Hold on. So listen. I know that it's not up to a business to do this, but still, it should be governments. 1.3 billion, 50 million people. Those are some numbers. I wish those numbers were a little bit higher, but whatever.
Wait. Yeah. Well, yeah. Just
what?
Yeah. So you're talking about a continent. The population of the United States is what, 330 million plus? You're talking about an entire continent, and 1.3 to vaccinate more than 50 million people. It's a great thing, but it's a drop in a bucket when you talk about the population of a continent.
Agreed. Totally agree. All right, let's see what else we got. Yes, it's a wonder drug, but it doesn't cure COVID-19. One of the biggest trials in Britain has learned that aspirin doesn't improve the chances of survival in severely ill patients. Since aspirin helps reduce blood clots and other diseases, it was tested in COVID-19. And although there was a small increase in the likelihood of being discharged alive, researchers determined that it wasn't enough to justify its widespread use. That reminds me, like in the summer, when people had their own little COVID packs when they got diagnosed with COVID, they would start themselves on aspirin and vitamin D and zinc or whatever. It was erythromycin. All of the things that just don't work, you know. And I remember aspirin being like, I guess, I mean, maybe because of the blood clot thing, but I don't know. Like, I wasn't warmed up to it, but, you know, I guess here now we know, right? Yep. You know, this is what good science does, right? Like,
time always tells.
If your plan is to be clever and buy a vaccination card online, you might think, again, the FTC says the real cards were never designed to prove vaccination long term, but the FBI said unauthorized use of official government agency seal can either get you fined or 5 years behind bars. Well,
stop selling the bootleg cards, folks. Just go get the shot.
Yeah, I am glad that they're coming down pretty hard. All right, these are some interesting numbers I thought you might like. So Gallup survey shows 76% of U.S. adults say they've been vaccinated or plan to be, a number that hasn't moved much in months. Among those not planning to be vaccinated, 78%, so let's say 80%, say they won't reconsider, and 53% say that they're worried about people choosing to not get vaccinated, and it's now wait a second. 53% say they're worried about people. Oh yeah, 58% are worried about people choosing not to get vaccinated, and it's now the public's greatest worry about the virus by far. So here we're seeing people who are refusing to be vaccinated, and I know that you and I have talked about ways of reaching out and communicating. And it's funny, I'll talk about it now. As you guys know, that Doc Griggs and I have been creating animations. One of the things that we were doing was trying to figure out ways to reach out those that are vaccine hesitant, and particularly those people who are vaccine hesitant. We've seen that a lot of them live in the South, rural South. They tend to be conservative. And so one of the things I was thinking when I was out on a run yesterday, Eric, was, what if we get we would have to ask permission for all this, and it may take too long to do, because doing these animations take a long time. But what if we got conservative folks that are, who are open to vaccination, like, Chris Christie was totally, into being vaccinated, and we animated them, right? And not in a way, like in a completely over the top, me, I like to make fun of, of the rich and the powerful. None of that, right? Like straight up, like Chris Christie would be animated, be like, wow, Chris Christie, and then have some of these more conservative minded people do the talking. Do you know what I'm saying? And you and I kind of walk through and do a little bit more of the medicine stuff.
That'd be fun and different and interesting, I think.
It would be interesting, wouldn't it?
Yep.
Anyway,
I think it's it's at least worth the discussion.
I think, we would have to obviously get the permissions to do it. We would need the website up, and they would need to see that we're legit and all that stuff. But all that being said and done, if we could figure out ways of getting more of the conservative-minded people in this country to look to the vaccine as being something that could help them, I think that if there was other added voices there, it would be great. And if it could be like sing-songy, that sort of stuff would be kind of fun. So anyway, just something to think about. I've been meaning to share that idea with you. So here we go. All right. Wait a second. We got here we go. A couple of really great comments here. The science and math support the effectiveness of the vaccine. I don't get why anybody would not get it. Second dose on May 5th, still not a zombie.
I keep doing this. I've been doing this. It hadn't kicked in yet. I'm just waiting. I guess my spider webs will come out and I'll be able to climb the wall. I'm just waiting. I'm still waiting.
Is that what that is? I thought you were having I wasn't catching the spider. But yeah, thank you, Matthew. And then here, Fetty says, Washington State's liquor. You know this is going to be in the rundown today. In fact, I think it's going to be the next story. Liquor and Cannabis Board announced on Monday the promotion called Joints for Jabs was effective immediately and would run through July 12th and will allow adults to claim free marijuana joint when they receive a COVID-19 vaccine. That is, in fact, that story is probably next. And in fact, let's jump to it because it was in the rundown. It's down here actually. How times have changed. Not only is marijuana a legal recreational drug now, it's being used as bait to get people to take a vaccine for their health. The Liquor and Cannabis Board of Washington approved a temporary allowance for cannabis retailers to offer joints for jabs. One joint for every adult customer who gets a vaccination at an in-store vaccination clinic. Doc Griggs, talk.
So how serious does it have to be? For people to really take it serious this is what we want to do. It's that important. We're going to make a temporary, we're going to suspend any penalty for cannabis. And if you come it's that much of a public health issue.
Well, it's legal.
It's legal, but what I'm saying is they're offering it. It's legal, that's fine, but hold on. I'm going to go to get a shot, and then I'm going to go get a joint. What? Like, not 10 years, not 1 year, not in a million years would I ever have thought that would be a headline or something. Those would be in the same sentence, but that shows you how serious of a public health crisis we're in. Holy smokes, and Batman. I'm waiting on my spider web to kick in. Batman, folks. I can buy Batman. I can be a broke Batman. But yes, holy smokes and broke Batman. Wow. Wow.
Joints for Jeff. It just goes to show how draconian our marijuana laws have been. Like Washington, here's what Washington's thinking. Man, we really need to get back, schools need to get back open, commerce needs to get back, we need to open up businesses, life needs to go back, the state's thinking we need taxes, for good reason, right? They need to get shit back. Oh, dang, they need to get stuff back. We're two for one, okay? I am keeping
it's track. Want to hit? All right, cool. Take this shot. Yeah, all right. What? Puff, shot.
puff, shot.
Or shot, puff. What?
Look at, and if you don't want to smoke pot, look what your other options are. Wine
you get
or
a shot.
Cocktail.
Huh? Yeah, you get a shot.
No, but if you don't want to smoke, your other options are a wine or a free cocktail.
Right, you get a shot for a shot, man. Hey, whatever it is, it's full service, but it works. Whatever it takes, folks. In all seriousness, it's that serious. We're in a race against variants, and the only way we're going to get out of it is if we use everything. The public health hygiene, that's a fancy term for wearing a mask, social distancing, washing your hands. Even though we've said to washing your hands, the fomites, it's not spread by fomites. I tell you what, I don't know anybody that's had a cold or the flu this past season, and the reason why that's worked is because of the masking, the flu shots, of course, yes, but masking, public health hygiene, social distancing, using common sense. So why not use all of these things in our bags so we can protect ourselves and enjoy being productive and trying to be back outside and not be sick? It makes sense. Yeah. Go get you a joint, a shot, and a glass of wine. And if you come to New Orleans, you get a pound of crawfish. You can get a catfish plate, whatever it takes.
Do you think that we would ever see joints for jabs here in Louisiana?
Maybe next year. We're getting close.
We're getting close. They passed the no jail time for marijuana.
Yeah, anything less than half an ounce is just like $100 ticket.
Right.
Half an ounce. That's a lot of weed.
How much is that? Like that's like.
I don't know. I'm not a weed. I don't know, but I know people that do smoke, and they're like, man, that's a lot. Wow, half an ounce.
Because I was like, I don't know.
And
I'm like, I don't want to ask Doc Griggs because I don't know if he knows or doesn't. And then you were like, that's a lot of weed. I'm like, well, clearly he knows.
Well, that's what they tell me. That's a lot of weed. Like I know a joint is that big, and I know it's nowhere near. From what I've seen of joints are about that big, right? And that's nowhere near an ounce in that. So I'm pretty sure there's a lot of joints in a bag. Yeah, that's that. Yeah. Half an ounce, yeah.
Well, still, that's great news. And I think the idea was they were trying to make it either completely legal or they were going to make recreational. Were we shooting for recreational this year?
I'm not sure. I do know that they're talking about flower. Is that a national conversation where they're talking about including actual weed? Like before, medicinal marijuana was like a pill or it was in a processed form. Now they're talking about actual flower. Like when they say flower, they mean actual weed to prescribe for someone to go smoke. Like things are slowly evolving. We're definitely living in interesting times.
Yeah, we are living in interesting times, no question about that. All right, let's see what else we got here. We got breakthrough infections. So for breakthrough infections, for those people who are vaccinated, 40% less virus in their body, and 68% to have less fever, and 2 fewer days spent in bed. So essentially what that's showing is that if you've been vaccinated, that you have less of a response. So that's really, really good news. We've seen that with influenza. Like I often say.
Wait. You said if you've been vaccinated, you have less
expression of
response. If you've been vaccinated, you have less bad outcomes or less expression of the virus.
Less symptoms. The symptoms are less.
Yeah.
So, which is great news. And then if you're symptomatic, you can also be asymptomatic. Like I often say, for influenza, it's like driving a car and wearing a seatbelt. The seatbelt's not going to prevent you from getting into an accident. But if you have that seatbelt on, you're going to be very happy that if you do get in an accident, you're going to be super happy that you had that seatbelt on. So to a large degree, we're seeing that with this COVID vaccine as well. And so that's really, really, really good news as well. Real quickly, Delta variant is wreaking havoc in Fiji.
Can we do a drill and this is not for y'all's sake, this is for mine. Help me here with the alphabet again.
Alpha is B117. Okay.
Why is alpha not the wild?
It should have been.
Got it. That's what threw me off. There we go. Okay. So the wild is still called the wild, and the wild, folks, is the original variant or strain, if you want to say it, or the original form that came out of Wuhan.
Right.
I hate saying it that way. They need to give it another name. Of all variants, of all classifications, the original one is the one that needs the most protective name because it's been so sullied.
Absolutely. Just like when I was on the radio today, like when I referred to it as the Wuhan virus, I was referring to it as the virus that emanated from Wuhan. But like I was telling you, I was criticized on a national program, which it was a fair criticism that I would refer to it as the Wuhan virus, but I wasn't referring to it as the Wuhan virus in a way that people were referring to COVID. They would refer to it as the China virus or the Wuhan virus. I was referring to, in the context of the conversation, I was referring to it as the virus that emanated or originated. From Wuhan.
Right. So, and if that is actually what you're expressing right now is the entire reason they came with a whole nother nomenclature naming system, because they didn't want the misnomers like the Spanish flu and those names to be incorrect. But the thing is, they left out the main one. Well, okay, what else do you want us to call it? Like, how else? Give me a letter so I can use that instead. Like, you got what I'm saying? Like, what can we say to be most respectful and have it consistent and congruent with the other names that you gave to these new variants? Like,
right.
What do you do?
I 100% agree, and they should have named the original, what we refer to as the wild type virus. They should have named it alpha, and then beta should have been
B117.
B117. But the way it is now, so it's not confuse anybody. Alpha is B117. Beta is 1351. Alpha beta gamma is P1. And delta is 1617,
which is India.
Is right. It's what originated from India, and then epsilon I think is P2.
That's Brazil too, right?
That's Brazil. That's South America as well.
Originated in Brazil or South America.
Right. So
folks, language matters.
Yeah, it certainly does. So kind of just going through a couple more headlines real quickly. The U.S. is expected to provide 500 million Pfizer-BioNTech doses to 100 nations over the next year. So that's good. I mean, again, you've got to take this number, split it in half. That comes down to really 250 million if we're going to give both doses. So maybe they're not. Maybe they're going to give one. So and 100 nations. It's just something about these numbers don't really match up. Of course, it's better than nothing, but there's 7.7 billion people on the globe, and 500 million just seems like an awfully small number.
So I don't know what your next story is. But did you see the story that millions of the J&J vaccines are about to expire like this week, and there's nothing we can do with them?
Jeez. It's
millions are about to expire this week, and there's not what about other countries that could use them? What about?
The issue with that is that we first of all, are expiration dates really real, or is it our expiration dates? We know, and we've seen examples of expiration dates just being put willy-nilly. So as to, when chemists go and they look at a drug that's been expired for a year, let's say, they go and they test that drug, it is like 99% pure drug, and so we know that to a certain degree expiration dates are sometimes done artificially so as to renew stock and as medical supplies. And doctors know this. And so one of the things that we used to do, I have done, is transported expired drugs into resource-poor countries. And that has been looked upon in the last couple years, maybe last 5 years or a decade even, that's not best practices. When we're doing kind of work in resource-poor countries, that we should not be bringing expired medications. We should be bringing, if bringing medications is part of your mission, then you should be bringing medications that are aren't expired.
But that doesn't address the problem of what to do with expired medicines that are still effective. Okay, we'll bring them. We'll bring current medications, but what do we do with these that are still effective? These work, and there are people that can use them. Why not?
I hear you loud and clear. Absolutely. It's frustrating. It's very, very frustrating. So I hear you. Infections are rising in Mongolia, where half the people have received the Sinopharm vaccine. So this is starting to become a problem. I'm beginning to eyeball Sinopharm and wondering if this is a vaccine that is not effective. We talked about this on Monday show, Eric, but cruise lines want to sail out of Florida, but a vaccine passport ban stands in the way. Have you seen or heard about that?
Yeah, I have. I mean, that vaccine passport thing is going to be an issue forever.
Yeah, it may even be an issue here in Louisiana too.
Yep.
So again, something to think about. AstraZeneca vaccine carries a slightly increased risk of bleeding. We're going to talk about that. More than a year into the pandemic, many Americans are still having terrible sleep.
Water is wet news.
and really sad. Fear of hate crimes make Asian Americans wary of joining the U.S. reopening.
That's horrible.
It is hard for me to read.
It's horrible.
But here saying the White House has reached an agreement with Pfizer and BioNTech to provide 500 million doses. So intense pressure to do more to address the global vaccine shortage and disparities in vaccines between rich and poor. The president hinted at the plan on Wednesday morning. So I have one, and I'll be announcing it. So that's happening, and and I wish that we would get more vaccines and more to be delivered to resource poor countries. Coronavirus cases are surging in Mongolia, where more than half the population is vaccinated, like we said, developed by Sinopharm. So we are starting to see countries that are getting Sinopharm vaccine. We've seen that also in the Seychelles as well. We go Chinese vaccines, such as one made by Sinopharm and Sinovac, using inactivated coronavirus. They've been shown in studies to be less effective than the vaccines developed by Pfizer and Moderna, which use mRNA technology. The vaccine initially came under scrutiny because of a lack of transparency in late-stage trial data. The vaccine faced more questions after the island nation, the Seychelles, which relied heavily on Sinopharm to inoculate its population, also suspects, although most did not become seriously ill. I'm surprised we have not seen more from what's happening in the Seychelles at all, because they should know whether or not they're dealing with, what variant they're dealing with. And in some virus variants may spread fast enough to cause concern even in countries where much of the population has vaccinations effective against them. Britain, of course, is dealing with a rise in cases linked to the Delta variant. So, despite having half of its adult population largely vaccinated with AstraZeneca and Pfizer. So we will continue to follow.
I was reading that second part. Despite, there was a question about Sinopharm, why they use it, why the government uses it in Mongolia. It came as Mongolia. Polls, prime minister said, okay, got it.
Got it. Cruise lines are going to make plans to sail this summer out of Florida, which one company called the cruise capital of the world. But we talked about that. State vaccine passports complicate how ships can navigate into ports. We talked about how there was a preemptive law by Governor DeSantis actually signed. So I think this is like a bad. I'm really disappointed by that. I just wish that that they wouldn't preempt and they would just let public health just do public health. But listen to this: people receiving the COVID vaccine made by AstraZeneca had a slightly increased risk of bleeding disorder and other possible blood problems at all. I actually have this study pulled, so we'll go over that again. But this is something that Doc Griggs and I have been talking about in detail. Another story that I thought was really good and interesting was researchers found that there was nearly 36 animal species that can harbor pathogens that jump to humans in wet markets in Wuhan. So this is, of course, stepping away from the idea that there was a quote-unquote lab leak or that it emerged out of a lab. But and this is kind of swaying us back into that the pandemic emerged out of a wet market. But again, I think that there's still a lot more work on that needs to be done, and we need to be focusing on how to prevent another pandemic. Of course, it's very hard to read. Millions of Americans maybe leading into summer, but a surge in anti-Asian attacks during the pandemic is not holding back many Asian American families from joining them. So, it's so hard for me to read the story.
No, it's horrible.
It's really sad, and we're Americans.
6,600 attacks on Pacific Islanders and Asian Americans in the last year. That's horrible.
Yeah, it's horrible. Your employer can legally require you to get vaccinated. So let's just be very clear. The bottom line is that companies are legally permitted to make employees get vaccines. I've been saying this since late December. So I get asked it all the time, and that is the answer I give all the time, which is they can actually do it. So please recognize that it is it is your employer's option to do. So here's that story about breakthrough SARS-CoV-2 infections. What we essentially saw here was a decrease in the symptomology. So here are several important issues with the concept of breakthrough should be noted. First is that the vaccines have high efficacy, but at least 5 to 10% of fully vaccinated are yet unprotected for reasons that we don't know. This percentage of non-takes among 100 million yields up to 5 to 10 million at-risk people. Can you believe that? Look at that number. That never occurred to me, Eric. That's such a good point, isn't it? The idea that we know it's 90 to 95% effective, and when you look at large numbers of 330 million people, those are some big numbers that even fully vaccinated people. So again, Eric, I'll let you say it. Is the pandemic over?
Absolutely not.
Here are the numbers. We need to forward this to Graylin. Graylin would love this, right?
Yeah.
Second consideration is that more than 1/4 breakthrough were asymptomatic, which is what we had mentioned before. So anyway, the bottom line is that if you do get a breakthrough infection, it's positive, and you're going to have less symptoms associated with it. So
that's 15 to 30 million people if roughly everyone is vaccinated. For 300 million people, that's 5 to 10%. That's 15 to 30 million people.
Yeah, it's a sizable number of people. Wow. Right? I never thought about that number. Next week, that's what we should talk about, right? If all of the U.S. got vaccinated, we'd still be looking at 15 to 30 million people who could still get COVID. Now, they're going to have less infection. They're gonna be getting into a car accident wearing a seatbelt. So,
but in a bigger picture, Mark Allen, that's what people ask what herd immunity looks like. That's it.
Yeah.
That's 100% of the population vaccinated. Virus can't really take hold to spread, perpetuate, but 15 to 30 million people would still contract the virus, which is in line actually with the numbers for the flu, because every year, right? What's the numbers for flu?
For
about 30.
For the number of people who get flu, I don't know.
30,000, I thought, right though?
Yeah, let me check real quickly. Because that's a really good.
How many people get infected in the United States with the flu? Number, not deaths, but infections.
Right. 9.3 million to 40. No, there's no way. Since 2010. So how many? Yeah, I would have to look it up. I don't know. It's got to be less than 1 million people.
That catch the flu?
Right.
It says CDC estimates that the flu is a result of between. Yeah, I don't know about that. Yeah, you're right.
Yeah, these numbers are. I would have to look it up.
They're saying 9.3 to 49 million illnesses each year in the U.S. since 2010.
Yes, I got the same results as well.
Yeah, but we'll clarify that one.
All right. Here we got in the 2019-2020, 400,000 were hospitalized, but 22,000 died. In 2019 wasn't that bad. It was 2017 and 2018 that were really bad. Yeah, remember how close we were to creating like an influenza fest, Vax Fest?
Yeah, Vax Fest. We were like that close. During Halloween. We weren't passing out joints for flu shots.
But we could do catfish plates, though.
Right.
Anyway, so here's some real world data. So these are not data that was obtained from a clinical trial. and protection against asymptomatic COVID-19 after one dose of either the mRNA Pfizer vaccine or the AstraZeneca vaccine was 6 and 28 days after one dose of either vaccine. So, and the clinical case was attenuated, which means that it affected the clinical course. And they say that these large observational studies are the same. So there's several other publications that say the same thing. And then what they also say is that a prime or boost strategy affords higher protection and is clearly preferable as long as vaccines suffice. So, and then this next story is something that you and I have talked about all. I was actually trying to talk, when I interviewed the amazing, really just, oh my God, such a, what's that?
Dr. Ferdinand.
Yeah, Dr. Ferdinand, just unbelievable cardiologist and just a tremendous career. I was trying to get him to comment on long-term myocarditis, but that man does not speculate at all. He is so data-driven. If it's not data to speculate, he won't. Yeah, he won't do it. But I was trying to get him to do it. But anyway, here's a story for you, Eric, that I thought you would appreciate. Myocarditis in athletes, prevalence was 2.3 based on cardiac magnetic resonance imaging in a population of U.S. Athletes. The study is limited by its focus on selected group of young competitive athletes, but still has value, giving us a ballpark estimate of COVID-19 incidence and showing that it often occurs without symptoms or an abnormal troponin test, echo, or electrocardiogram. So what this essentially just tells us is that it's there. It's a small amount, but it is there, and it's something that we do need to recognize. And again, these could be potentially long-term complicating issues as well. So something for us to recognize, think about, and to know. Here is a study called the Epidemiology of Long-Term COVID-19 Symptoms. And nearly 3/4 of patients had at least one persistent symptom following SARS-CoV-2 virus. So what this really tells us is something we've already known here. Nearly 3/4 of patients reported at least one persistent symptom for a mean of 2 to 4 months, and some symptoms were reported for as long as 6 to 8 months. The most common were fatigue, shortness of breath, anosmia, anxiety, persistent cough, ageusia, and then depression. Explain to me anosmia and ageusia, Doc Griggs.
Anosmia means you can't smell. A without anosmia is nose, you can't smell. Ageusia, gusta is taste, so you can't taste. Ageusia.
So would you consider yourself ageusia? You have no taste?
Nah, if I said that was a good joke, then maybe so. Maybe so. Only if I thought that was funny or thought it was a good joke.
All right. So long-term symptoms exist, and we know that. In large randomized trial, convalescent plasma strikes out among patients hospitalized with COVID-19. Convalescent plasma did not improve survival over usual care. This large randomized trial did not demonstrate a survival benefit of convalescent plasma in hospitalized patients with COVID-19. The findings should steer us away from such treatment in this setting. However, the study does not answer whether convalescent plasma would improve outcomes among high-risk patients, whether early in their course. We've talked about that before, and that also whether convalescent plasma you get has a lot of antibodies built into it. Remember, convalescent plasma, this plasma is somebody who else has had COVID, and what we found and we presented here on a COVID NoiseFilter was that those people who had higher amounts of antibodies in the plasma did better, and that makes more sense. But what I want to talk about is Scott Gottlieb. Who's Scott Gottlieb? Remember him?
No, I don't remember that. I remember Gottlieb. I don't remember Scott Gottlieb.
Okay, maybe I got the name wrong. Remember Gottlieb?
I remember Gottlieb.
He was the former commissioner for the FDA.
Yeah.
And remember, he got pushed by the president to say that the clinical trials showed that there was a significant improvement in that trial at the Mayo Clinic, and
Yep.
how even the people from Mayo were like, "No, that's not true."
No.
You and I were screaming from this very show, saying, "Oh my God, how did he say that?" But you know what this shows? It's something that you talk about all the time: is that politics and science can't mix.
No.
And what happened was that he got snookered because that's what he wanted to hear. That's what he gave them.
You got snookered. That's a good, snookered. Like that term.
Anyway, let's just, we got 10 minutes left, so let's quickly jump to some data real quick as we're kind of winding this show down and kind of landing the plane, if you will. Let's see. So globally, 174 million. So we're almost at 175 million cases.
So we'll be there by Friday, definitely, right?
Yeah, for sure. For sure, because we're at 362,218. So, and deaths are 10,240. Number of total cases are 3,771,572. New cases again, 362,000, and then deaths 10,240 from the last 24 hours.
So I want to make an observation, and help me if I'm incorrect. But do you remember when that number was down a few months ago to 2.5? We're back up to 7 deaths per minute worldwide, globally
now. Yeah. Well, I'm wondering if this was in the U.S.
Yeah. I don't know.
The U.S.
I remember at one point things were slowing down globally. Remember?
Let's hang on. I can answer that question in a moment.
Yeah.
It was. Yeah, I mean,
could be wrong.
Yeah, I mean, I think we're down, but I mean, what we need to look at here is we're starting to get to levels of where we were at that we've not seen levels this low
in a year,
in a long time. Yeah, I mean, we saw levels this low in early February, but if we can get lower, we're starting to get to levels like where we were in the summer. This is what it's like in the U.S. U.S. data looks great. Death is a lagging indicator.
Can't see it.
You can't see it?
I can't.
Oh my goodness! I've just been showing all this stuff. So this is what I meant by we're at levels not seen in a while. Since February. Here.
So what I see right now is a black screen. There we go. There it is.
Okay, got it.
There you go.
All right. So what I was saying was we're seeing levels that we haven't seen since like almost February, and then if we start going lower, we're going to start getting to levels of where we were in August and October.
Good.
Mortality going down as well, which is really, really good. We're still seeing significant hotspots. We heard about Mongolia a moment ago. We read about Mongolia and what's happening in Mongolia. And the Seychelles Islands, I think, are off here, but I may be wrong on that. See that South America is just on fire. We're still seeing Argentina and Uruguay and less so Paraguay and Colombia and Costa Rica. And so we really, 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 and then again, these are countries that are some of the highest vaccinated countries in the world. Look at that. So this is a huge concern for me, because this to me shows that these are the countries that Colombia, highly vaccinated, Argentina, highly vaccinated, but they're the hot spots. You know why?
Breakthrough.
They got breakthrough. They've got P1 and P2. So that's really, really, really a great concern. Here we've got countries that are fully vaccinated. The U.S., interestingly, portion has the most number of vaccinated people. This is why people around the world are desperate to try to get this vaccine because they're just not being fully vaccinated around the world.
Yeah.
2.1 to 2.2 doses have been distributed with 37. Yeah. But remember, these are also multi-dose vaccines. So, because 2 billion out of 7 billion, wow, that's starting to make a dent. But remember, this is more like closer to 1 billion plus. 37.8 million doses a day around the world. So that's really good. And again, I just wanted to show you not the country of Africa, but the continent of Africa, just how little vaccinated it is. This is the distribution of vaccines throughout the world. So it's really quite sad. How much time do I have? I have 5 minutes. All right, let me rush through this all here quickly. Here's the U.S. New cases 13,542, 400 deaths, and number of total deaths are 613,195. So we probably are not going to go over the 750,000 unless it starts to hit some of those rural pockets that we were talking about before. But cases are really going down, as we can see. We are at the lowest per 100,000 at 33 per 100,000, which is so incredibly low. And look at this, Doc. I mean, we're at levels here that we have not seen since about exactly a year ago. You know, so it's just unbelievable. Here we were flattening the curve, which we did to a certain degree. This was the second spike. This was the massive third spike that we had. Testing is going down. Hospitalizations and deaths are all going down, which is really, really news, and we hope that stays this way. Here's what the vaccine map looks around the world. I'm sorry, around the country. You can still see the South here is still doing really, really poorly. Just north of us in Louisiana is Arkansas, and unfortunately, it's really quite bad up there as well in terms of just not nearly enough people are being vaccinated. There's nothing to show here. I already showed you this. Remember this? This is insane. This is that spike in what we refer to as the alpha variant, and we showed that a little bit earlier in the show. So wrapping this up, thank you to the University of New Mexico and Dr. Ian Doria for making this show available to us. Let's see. So here in Louisiana, we added 102 cases, which is, I can't believe that's where we are. That is so low, and it's great. And thankfully, our deaths are going down dramatically. Here you can see that we've hit a plateau, and we're pretty stable at that plateau. Well, and then looking at Louisiana proper. What's that?
Excuse me, 1 second.
All right. We're still in the medium. It looks like the number of new cases has gone up just a little bit. The infection rate is more or less stable, and test positivity is more or less stable, and the number of unvaccinated from Monday to Wednesday has gone up 0.2%. And then looking at the city, it looks like the numbers are going up per 100,000. The infection rate is also going up. Test positivity is nice and stable. And about those people who initiated vaccines, about 48.2% of the total population, with 43 being complete. So that's where we're at. It's really good news. I think that we have done a really good job with getting folks vaccinated here, but we need to do better, and we can do better, and hopefully we will do better moving forward. We know that the best way to get people vaccinated is expression of compassion. So if you know people who are not vaccinated, we really encourage you to be very compassionate. So don't do what feels right. We just throw a bunch of science. You see, science says this, and we know that doesn't work. So with that, thank you guys for tuning in. We'll be back on Friday. I am going to be giving a presentation to the public health group. They are asking for variants, so I'll be doing a very variant-specific stories as well. So any last words? We got to go.
No, get checked, get fit, get moving, get vaccinated.
Peace out, everybody. Health is a human